All right, we're live. So let's go ahead and we're gonna, you know what? I'm gonna talk here a few minutes. One of the magazines that therapists look at is this APTA magazine. So, the American Physical Therapy Association, or APTA for short. If you're a member, and if you're a physical therapist, you probably should be a member of your organization. It's expensive. It's $300-400 a year just to be a member, and then there's specialties within that, whether it's you're treating orthopedics or you're treating ICU inpatients. So there's like any other profession, physical therapy has separated itself into certain or specific what's the word I'm looking for, specialties. That's the word I'm looking for. And so if I peruse this magazine here, I think I'll be doing that, see what you guys think. But we're going to look at what's called commercial payers. So this is what physical therapy is dealing with, as well as other disciplines. Chiropractic has been dealing with it forever because most insurances don't recognize chiropractic as an actual medical treatment. So that's a whole other discussion for another day. But when you go into the doctor's office, or in this case, going to physical therapy, and you think, your insurance is going to pay for it, right? I have insurance. I got Blue Cross, or I got, Medicare, or whatever it may be. It's usually going to be probably, if we're talking about Medicare, and there's, Medicare Part A, B, and then there's the Advantage plans, the HMO plans, Medicare Blue plans, even Medicaid, state and federally funded insurance, or used to be known as welfare insurance back in the day, but now it's called Medicaid. Even that has, separated itself into multiple managed types of Medicaid itself. So I digress when it comes to all the different kinds of managed insurance companies and plans that they have out there. It's its own profession. So when you go and you see your medical doctor and you're going to see a physical therapist, they're probably not going to know your insurance. They're going to get basic authorization, right? And you're going there and you're like, okay, I got, let's say, Blue Cross Blue Shield. You're going to get your evaluation. They're going to have to send their evaluation in, and hopefully they'll get 6, 7, 8 visits, or maybe they only get 3. It really depends on what the insurance company is really going to pay. And it's kind of crazy here because a lot of physical therapy over the last probably 5 to 6 years has really been pushing, all right, you're coming out of school with, let's say, $125,000, $150,000 worth of school debt, and you're going to get paid 50, 60 grand coming out. Now that sounds like a lot, 50, 60 grand a year to some people, but you got to put taxes on that. That's probably between 23 to 25%. And then you got your school loans on top of that. So you're poor. I mean, you're when you look at taxes and just the school loans, just those two alone, yeah, they're going to wipe your salary out 50, 60 grand pretty quick. So a lot of the professions really push towards, doing stuff on the side hustle, maybe quote unquote opening up your own practice and really only taking cash customers. So physicians have been pushing this for several years, and now physical therapy over the last probably, I would say, 5 or 6 years, they've been pushing, and I read these magazines all the time, and they're always pushing that kind of stuff. So when it comes to these insurances, it is quite daunting. So when you go to your medical professional, whether it's your PCP, your primary care physician, or you're going to a specialist, make sure you know your insurance. Like, for instance, some insurances like mine, they have a tier system. And if you're not in tier 1, you could be in network. There's a nice phrase. You're in network, but guess what? If there's a tier system of your insurance, that medical provider, that's in network, is a tier 3, which means is you're going to have to pay a lot more on your deductibles and on your co-pays before the insurance company will kick in, versus if you went to a tier 1 medical professional, you'd have your co-pays and deductibles would be a lot less. So make sure when you're out there doing that your insurance is a lot less. So that's huge. When we look at this particular magazine here that everybody gets each month. And we're just kind of flipping through it here for a second. So here's a nice quote here. We have to help our members see the value in raising their hands or taking the time to reach out to their patients and legislators to be active participants. So right there is telling you in that phrase that, hey, we realize as a profession that these insurance companies are going to continue to pull back. They're going to continue to keep their premiums high. And unfortunately, people out there in the world, working world, don't realize their particular insurance and what it's doing to them. So be very mindful of your insurance and exactly how much they're going to pay, how much you have to pay when it at least comes to physical therapy. And I know just you going, like I said, to your PCP, you're going to pay a fortune, especially if they're a network, but you have a tier system. Here's another great quote from it can feel like tough going, but along the way, there are points of bright light and there are opportunities. So here we are talking about this American Physical Therapy Association magazine. It's literally telling us, hey, we realize there's problems out there in our profession, and there ain't a hell of a lot we can do about it. So these are certain strategies that you can do to help yourself, realizing that, yeah, school's through the roof still to get to be a physical therapist, which is 7 to 7.5 years with that much debt, and the pay didn't go up with it. You know, then you're talking about everybody taking a hit on the inflation. You know, and you take that hit, and then you take school loans continuing to rise, and your salary not continuing to rise even close to with it. Now the profession as a whole is trying to backpedal and say, oh yeah, here's some other ways that you can try and work your way to success. You know, so it really is daunting. Unfortunately, it really does not say more than that in this particular article. I wish I had better news for people getting out into the profession as a whole. I think getting into the profession at this time is probably one of the worst times. I would equate it to probably in the late 90s when I was coming through, and we had managed insurances. They were cutting back on what they were going to reimburse with therapy. They stopped paying for hot packs and cold packs. They limited how much they're going to pay for ultrasound. They stopped paying for infrared completely. There was a modality out there called diathermy that was big back in the day, that was used to manage pain and warm up tissue. They stopped paying for that. So the people that are really, unfortunately, not telling us what to do and what not to do, that's the thin line. But they're paying or not paying for it. And so the reality is if most insurances aren't going to pay for it, and you are not filthy rich as a client or a patient, however you want to be labeled as, then the reality is yeah, you're not going to get all those other treatments that even people used to get back in the 90s. Now, did some of those treatments turn out to be not as effective? Yes, this is true. But the reality is some of that stuff is still effective to help increase or promote your healing with some of the newer techniques today that they're just not doing, because the reality is A, it was time consuming, and B, they're not paying for none of it. So that's it in a nutshell. And this is coming from my organization. Now, there's lots of other journals out there, a lot of peer-reviewed journals that talk about different types of, like I talked about last time, back pain, what you need to do. Now, all the stuff I talked about last time, and what was it, 2 or 3 days ago, really comes from peer-reviewed journals of what you're supposed to do when your back hurts. It's my profession for 20 some years, on top of this is what the peer review research shows, or concludes, I should say, not shows, it concludes, that if you do these particular things and you do them consistently, your symptoms will definitely improve and more than likely get to the point where they're not there anymore. So it's very important that you do these things. Oh, hey!
Did you set your time for July, right?
Yeah.
End of June?
Yeah.
29th through
You want to come on my video? Yeah? Yeah.
All right, because I think I'm going to order tickets. Right now, the flight up
Okay.
is $19 a piece.
Okay. All right, go for it. You hear that, folks? We're going to Pennsylvania sometime this year. Yay.
It is into Philly, but it's an afternoon flight. We won't be arriving at night.
Okay, you hear that, folks? Oh, sorry about that. All right, so I got 10 minutes in already. Boy, it's quick to go through this. 10 minutes is like, it's like that. You know, I thank you guys all for coming. Hopefully you got a little bit out of this in regards to what your insurance, what you should worry about, where the profession's going, and where I'm getting some of this information from. All right, and until next time, like I always say, look up and keep smiling. Bye, folks.